Hi, my name is Shatera Calabales. Today is March the 8th, and I will be doing my checkoff for my insertion of indwelling catheter. First, I would check my physician's orders, and I will gather all my equipment, which is the indwelling catheter. Okay, go into the patient's room, knock, introduce myself. I would then go wash my hands, identify my patient in two different ways, which is the name, the date of birth, and I would also assess for allergies at this exact time. So from here, I'll explain to the patient about why they'll be getting an indwelling catheter. Hi, Ms. Blackwell. My name is Shatera Calabales. I will be your nursing student today. I will be inserting the indwelling catheter. You're ordered for indwelling catheter because you're going to be having a appendectomy done today. And normally during surgeries, you have to have a catheter just to prevent the bladder from filling up during the process of your surgery. So that's why you're initially going to be getting a catheter inserted today. So from here, I would obtain a consent form. So they would sign the consent, and from there I would set up my sterile fill. So I would open. Okay, I would use this as my garbage bag. And I'll set that up right there to my left. I'll remove any jewelry I have. Okay. My catheter is here. My person is there. So I would, from here, open my catheter. Okay, and from here I would take the bottom as I touched before and kind of turn it to a square so I don't take any chances with contaminating my field. Okay, here I have my sterile gloves. So I would grab that, come over here. And at this moment, I don't have that much space, so I'm going to slide on down this way. So I'm down. All right. Push my bag over a little more to the side. Okay. I get my glove, pinching it at the cuff. Then my next one, I will go underneath the cuff. Okay, and from here I can touch anything in my sterile field. Okay, first we have a blue drape, which my blue drape I will be using to kind of extend my sterile field. Okay. Okay, keeping my hands below my shoulder. I will cuff my drape in that manner, and I will go underneath my patient, asking them to elevate their bottom area so I can put this underneath them. Okay, Mrs. Smith, can you elevate your bottom for me so I can place this drape on you? Okay, and I will go in, leaving it there. Okay, we also have this drape, and I will put that over the vagina area. And leave it. Okay, I have my application. Okay. I have my iodine. The patient is not allergic to any iodine, so from here I would open it up. I will sit it in my box. I have a syringe with 10 mils of sterile water. So from here I will connect that to my catheter. Okay, I will put that back. Okay, I have my lubricant. I will open. Okay, from here I would have this urine cup for a specimen. I don't need it at this very moment, so I will empty this into the trash can right above, which I will slide and drop. Okay, I'll get my catheter out. And drop. From here, I'll insert the tip of the catheter 1 to 2 inches into the lubricant, to lubricate 1 to 2 inches. And from here, I normally like to keep it in the lube until I'm perfectly ready for it. Okay, so from here, I would tell the patient that I'm about to touch them and start the procedure. Mrs. Smith, I'll be starting the catheter right now, so I will use my hand as a kind of like a C and open the labius up. So I'll open and go up. Okay, from here I will get one swab. First clean from top to bottom to her left, then drop into the trash can. I grab another one, go from top to bottom on the left side, drop, then I'll get my last one, and I will go from top to bottom straight down the clitoris, and I would drop it. From there, I would take my iodine, and I would drop it also into the trash can. Okay, so I will be instructing her as soon as I get ready to insert the catheter to bear down as if she has to urinate or anything. Okay, Mrs. Smith, I'm going to get ready to insert the catheter. So I will take it out my lube. Okay. And it is flapping everywhere, but it's still in my sterile field, hasn't touched anything. Okay. I grabbed it, and I am about 2 to 3 inches underneath the lube tip. Okay, Mrs. Smith, can you bear down like you're going to urinate? And at the count of 3. 1, 2, 3. I'm going to insert into the urethra. Okay, I have urine flashback. I'm going to insert another inch and a half. I'm going to hold my catheter in place. I'm going to inflate my balloon. My balloon is inflated with 10 mils of sterile saline. I will remove my syringe, drop it. I will, from here now, the procedure is complete, so I can touch wherever I need. I pull just a little to see if the catheter is taut and it's in place. From here, I would attach it to her thigh, giving it a little slack to make sure it don't pull and have any, potentially cause any trauma to the urethra and the perineal area. I will attach it to her leg by using a leg strap, and then I would hang the catheter bag below her bladder, below her knees, on a bed frame, never the bed rail. And from there, I would clean up everything. Okay, from here, I would check the color, the amount, and the clarity of the actual urine. And I will make sure that she's educated if she has any pressure that she feels that's starting in her bladder area, to make sure she notified any staff to make sure that it is not any kinks or blockages in the catheter causing any discomfort, and to make sure that it never becomes detached from her leg and just hangs on the floor, to prevent any source of any trauma or anything. And from there, I would make sure the patient is comfortable, call out and reach, bed lowest in position until the procedure starts. That if they're NPO, make sure if they need any, that they have nothing per the hospital's facility. If not, they can have some ice chips if the doctor says that's okay, and just make sure that their environment is good. And for discharge, for de-seeing a catheter, you can just, same concept, just reverse, get a 10cc syringe, use the balloon, deflate, count to 3 and ask the patient to bear down as before, and pull it out very slowly to prevent any trauma. And that should be it. Thank you so much for your time.